How long do you have to take your GLP-1 medications, semaglutide or Zepatide? Let's talk about it. If you're new to my channel, hi, I'm Dr. Jones DC, a holistic obesity expert. I work with medical practitioners. We prescribe the meds, we prescribe the peptides with the goal of weaning off, but with lifelong weight maintenance. Well, this is the $1,000,000 question. This is the elephant in the room, right? How long do I got to take it? Well, this is a complex question because who's asking the question? Are we talking about a 400-pound morbidly obese person, or are we talking about a 150-pound person who needs to lose 20 pounds? Now, this isn't a discussion of whether or not that 150-pound person should be taking it. That's a separate conversation, and I personally think they should. Everybody should have the right to make a better decision for themselves, but that's a separate conversation. But what we do want to talk about is how long you should be taking it or you need to take it, and we're going to have to look at the different categories. So let's start with obese, morbidly obese patients. In this category, you have a disease. What is the disease is also the $1,000,000 question too as well. I like to think of it as a pre-existing condition that makes it harder for you to override whatever it is. In this particular case, it's losing weight and maintaining weight loss, right? I happen to think that the obesity is 50% genetics and 50% lifestyle, but it's a disease, and you're going to have to work a lot harder to lose weight and keep it off than people without the disease. And so in this category, it's going to take the medications and probably other peptides too as well to just get the ball rolling and start the program and start the weight loss, right? You've put your best foot forward, you've tried your best, but nothing else has worked. The medications are going to be a godsend for you. Now, how long do you need to take it? Well, the truth of the matter is we don't have that question answered. When you look at the literature, if that's what you're relying on, they show that most people begin to regain, a large percentage of the people regain. In fact, this randomized control study, 1 year after stopping semaglutide, about 70% of people regained all their weight. And I'm pretty sure they're going to see if they do a follow-up 2 to 3 years later, it's going to be upwards of 80, 90%. We know that there's a great likelihood of weight regain. So the inevitable conclusion is, well, we got to take this medication for life, right? And I think this is why the majority of obesity specialists out there and patients that are doctors that are in the trenches working with patients feel that this is the best method. And I respect every one of those obesity specialists out there because when I look at what else exists out there, which is med spas and clinics popping up, just trying to make a quick buck right now, prescribing these medications, knowing what very well when the patient is using this for what they want to, which is to jumpstart their weight loss and with the plan of weaning off, and they fall flat on their face hard when they find out how difficult that is, and the clinic's just prescribing it anyways. So that to me is unethical. But based off the literature, what they're doing, obesity specialists out there, is the right move. But I can share with you what we've done at this point, and we have successfully weaned patients off who are currently maintaining their weight. And the majority and consensus is that it's easier for them to do that. Whether you are morbidly obese or whether you need to lose 20 pounds, the key is taking advantage of the increase in destruction of food chatter and increase in ability to do the right things, to make the right decisions, so that you can beat this disease. You beat the disease and you can eventually maintain your weight while weaning off the medication. How long should you take it is however long it takes you to hit your weight loss goals, however long it takes you to install and live and breathe this new set of lifestyles choices that are now part of your regimen. No different than brushing your teeth twice a day. I lift weights. That's just what I do. I eat healthy on Monday through Friday, whatever particular scenario you decide to do. But these are the secrets that nobody wants to talk about and ultimately are going to dictate how long, in my opinion, you should be taking these medications for. If you guys want to learn more about our program, how we approach this structured approach of deep lifestyle intervention so that you can have a greater chance of being successful, in my opinion, from what I've seen, click my icon, scroll to the top, click that link there. You can submit your information, schedule a free consultation, guys, and I look forward to working with you.